The Quality Improvement Committee, and this part is led by Reese, who we have all helped her to develop some templates in the system. For example, on our Medicare annual wellness visits, we have a template that takes providers step by step through correct coding at the beginning of the visit, guidelines for screening, the guidelines for immunization, guidelines for cancer screening, all the way down the line. And so we implement those, and so that it's just basically check boxes so that you can capture that as hard data. We also have alerts set up by clinical event managers in the electronic medical record. It's not as good as I would like, but it's okay. We really push a lot of this management down to the staff, and it's up to the nurses and the nurse assistants who are checking the patients in to really make sure that each patient, even if they're there for a cold, is up to date on all of their annual screening. If they have diabetes, did they get a hemoglobin A1C checked in the last 6 months, things like that. The other way that we do this is we have another electronic dashboard that we purchased that isn't up and running yet. But the purpose of that is that each morning, when we have our morning huddle, the nurses can look at that and see each patient who's coming in and what they're deficient in. And so that way it helps us flag things a little bit easier. But it's always supposed to be in front of the provider so that we can make it happen. As a federally qualified community health center, we have a pretty needy population. We have a large proportion of people who don't have insurance. In South Carolina, of course, Medicaid wasn't expanded, so that didn't get much smaller. And so they're a lot needier. And so in our system, we try to have, for every provider, we'll have one nurse who's checking people in, but also a nurse assistant or equivalent who is the case manager. The case manager takes care of all of the referrals, but more tries to shepherd the patient through the healthcare system, because a lot of these people are a little bit healthcare illiterate, don't have any funding, don't have any insurance, and so it's a matter of keeping that patient connected to the healthcare system, trying to get them plugged in to what they need, even though that might not happen tomorrow, and basically being kind of a quarterback and keeping track of everything. We make referrals out and have it set up in the electronic medical record system that if we haven't heard back from that consultant, that we call again in a week and say, what's up? Because otherwise these people fall through the cracks. First, I think the case manager, his or herself, has to have at least a certified nurse assistant level education as a baseline. You know, they have to be able to interpret medications. They have to be able to interpret studies when people are asking for things to be ordered. So that's kind of a baseline. The nurse assistants all go through training as they come in, and it's fairly extensive. First of all, training with the nursing director, Ms. Causey, Cindy Causey, and also then with each site supervisor, who is an RN. And so by the time they get plugged in, they have a pretty good idea of where we need to go. And although each provider does things differently, we try to make it so that everybody does the baseline things the same, so that we have 6 sites now and 250 employees. So you have to have some uniformity and some reduction in variability, or stuff isn't going to happen. The education is mostly internal after that. And again, we keep things up to date with quarterly meetings. We have lunch and learn sessions where during lunch, the center will provide lunch, and we'll have the nurses and assistants stay for a webinar or other educational tool that will help keep them up to date on those things.